Hi there, and welcome to Gigging Out. In today's episode, I speak with Crystal Fullilove, healthcare staffing analyst at SIA. Crystal shares her take on the state of the healthcare staffing industry, including what it takes to scale a firm, talent acquisition strategies that work, how to approach digital transformation, and so much more. She also calls out what healthcare staffing leaders should be worrying about, but they aren't, and what separates successful firms from those that struggle. I hope you enjoy our discussion as much as I did. Crystal, thank you so much for being here today. I'm excited to interview you.
Dana, thanks so much for having me. I'm thrilled to be here.
Awesome. Well, let's kick things off. I would love to just have our audience learn a little bit about your background in the healthcare industry and what do you currently do at SIA?
I have just under 6 years of healthcare staffing experience. I actually started out my healthcare career working in human resources for a large health system in the state of Maine, which is where I reside. I managed their contingent traveler program for all 12 of their hospitals. I was primarily focused on travel nursing and allied needs, and I did some locum tenens to a lesser degree. I spent 3 years in that role, and that really helped me understand the complexities of healthcare staffing, including, the nuances that exist between different occupations, different departments, as well as really how to navigate the different chains of command and how to manage a vendor partnership. I then spent a little over a year working for one of the largest health staffing agencies in the United States, and I managed an MSP account for a large health system, and that exposed me to the staffing side of the business. And so that gave me, that well-rounded understanding of how healthcare staffing actually works from the staffing side and from the buyer side. And then that brings me to SIA in my current role as a healthcare staffing analyst, where I've been for a little over a year and a half, and I am responsible for conducting and publishing research around the U.S. Healthcare Staffing Agency. I do some research in the UK healthcare staffing market to a lesser degree, and I provide insight to healthcare staffing firms and suppliers around market conditions and, forecast anything that's really trending. And it provides data to them that helps them understand the conditions that exist in the current market so they can make the best business decisions for not only their own companies, but for their clients.
Very cool. So you obviously have a wide variety of expertise in this industry, probably kind of seen it all. I'm super curious how the industry in your eyes has evolved over the years. What are some of the things that are true today that have always been true? And then what are some of the things that are maybe surprising or different now than what used to be the case in the industry?
Yeah, I think I have to say the nursing shortage is a constant that pops up in my head. First and foremost, we hear this every day. It dates back to the 1930s. It's been top of mind for hospital executives for decades. So we had the last nursing crisis. It was like between 2000 and 2002. Nurses expressed concern over nurse-to-patient ratios, their long hours that they work, their long shifts, and working conditions, which sounds very similar to what's presently happening. But, if we move forward 20 years later, where we experienced another large nursing crisis. And that was really during the COVID-19 pandemic. So the total supply of RNs decreased by over 100,000 in 2021, and that was just 1 year. And then we have, current projections from the Bureau of Labor Statistics that talks about, having openings every year of around 193,000 through the next 10 years. So it's a shortage that's continuing. So that's definitely a constant that's top of mind for me. And then another constant would really be inadequate staffing and concern for working conditions. Healthcare strikes in the U.S. are not new, and it's really like leverage for healthcare workers so they can address things such as their wages and their benefits and their staffing concerns. So it brings their concerns to the forefront, and it provides health systems really with an opportunity to update their care models or prioritize their succession planning. Ultimately improving, patient care in the short and the long term. But it's a constant. It dates back to the 1970s. But I think the concern is really the increase in strikes, suggesting that, healthcare working conditions haven't really improved over time, or maybe they haven't improved quickly enough or meaningfully enough. If we think about some changes, there's a shift in employment setting. So historically, non-hospital employment, I'm talking about ambulatory or outpatient facilities, they experience lower growth than hospital employment. And so there's actually a recent study in a virtual event that I attended that I thought was great. There were two health economists. It was Dr. David Arbach and Peter Bierhaus. So they had a grant and they were able to study the nursing workforce. And it just uncovered the shift in where RNs work And workforce growth from 2018 to 2022 actually occurred almost entirely in those non-hospital settings, the ambulatory setting, which is really brings us back to pre-pandemic levels. But the issue is that we're still hearing some hospitals who are talking about shortages of RNs, despite that overall workforce growth that we've seen. So there's a shift that's occurring. And then I think flexibility is a change. And that is a big one. So, it's kind of worth talking about a little bit more in depth. And there are a number of studies that have been conducted, not just by SIA, but some large healthcare staffing firms and consulting firms. And it really indicates the growing desire for flexible scheduling among healthcare professionals. And we know that the pandemic's impact on healthcare professionals is wide-reaching. There's a checklist, right? Worker shortages, unsafe working conditions, burnout, an increase in mental health conditions. So staffing firms that were able to provide their workers with flexible work arrangements, whether that be accommodating block scheduling or not working holidays, no weekend, or even per diem and on-demand, which we're seeing, it provided a better work-life balance to healthcare workers, and that can ultimately reduce burnout and it can improve employee satisfaction. Just along those same lines, we have an annual report that covers temporary staffing platforms, and I'll get to why that really applies to this. But they're designed to optimize matching to temporary workers. They're designed to leverage automation that deploys workers faster, and they're going to deliver higher fill rates with little human interaction. But platforms have actually been increasingly preferred by healthcare workers. They can accept their jobs, they can search for jobs, and they can manage their own schedules. So that's a big one. In addition to that, we have a Workforce Solutions buyer survey, and we want to look at kind of a mosaic of data points to make sure that everything aligns and is telling the same story. And in our buyer survey from 2023, we asked buyers that very question, like, what are you doing? What actions have you taken to address the talent shortage? And pay increases are the top action taken, which is no surprise. We can see that everywhere. But allowing more flexibility came in at number 2. So there was 57% of buyers that participated in this survey that stated they have provided more flexibility to their workers as an action to kind of address the talent shortages. So I think that just says that the flexibility exists now, and it's going to be difficult to really go back to traditional rigid scheduling, which has historically been found in hospital and facility staffing. The last change I think I'll touch on is generational differences, because that's top of mind as well, and it's very relevant. There are now a big gap in generational differences that exist that buyers and staffing firms should really be aware of. So as the population ages, meeting workers where they are and meeting their expectations are really going to be paramount to reducing the effects of the shortage. So we have another survey, it's our recent travel nurse survey, where we found that baby boomers are more likely to shy away from technology and to work exclusively with traditional staffing firms. But millennials and the Gen Z cohort are actually more likely to use both. And there's a sizable group who are actually using platforms exclusively. So I think what's important to note out of this is that over the next 10 years, millennials are actually going to make up about half or more than half of the workforce, and Gen Z is going to enter the workforce. So staffing platforms are actually providing a means to reach healthcare workers who don't have that typical 9 to 5 working hour schedule, and they may have greater success and have a greater impact on minimizing the effects of the shortage.
That was so much good information. And I feel like you teed up all my follow-up questions, which is amazing. I love it. Let's jump in a little bit about, what motivates people you brought up flexible hours and higher wages. We did a research report recently, and we found that almost half of healthcare workers are thinking about taking on temporary work, but 60% hadn't tried it yet. There's maybe some hesitation. I'd be curious, for healthcare staffing firms that are trying to attract talent to their platforms, maybe taking people away from full-time roles or whatever it might be, what are the talent acquisition strategies that you've seen work? How do they make the benefits of temporary staffing jobs well known? Can you speak to that?
Yeah, I think we can touch on a few of them, but really, I would want to emphasize flexible work hours, leveraging job boards, using employer brand, leveraging AI, marketing workplace culture, offering the best pay packages that you possibly can. And I think maybe the most overlooked is the ability to make a worker feel valued. So many healthcare workers have admitted that the reason that they've been with their healthcare staffing firm for so long is actually because of their loyalty to the recruiter, not to the firm. So clinicians love recruiters that have a conversation with them. They love those that are relatable, those that are transparent about the pay, the whole package, the role that they're considering, the facility that they're looking at. And they present them with all travel options, not just the role that they may have been submitted to, and who, stand behind them when they have rough days, which we know that they have. So I think that's important too. And if we're talking about, clinicians who are considering temporary work, I had mentioned that report that I tuned into in that virtual event I tuned into by Dr. Arbach and Dr. Bierhoff. Those employment changes that I referenced from 2018 to 2023 that found those large increases, they were actually found in outpatient care centers, but they were followed by employment agencies. And so that lends itself well to your research. That suggests that more workers are actually moving towards employment via staffing firms and trying out contingent work. I think the question is going to be how permanent of a move that's going to be. If staffing firms are able to maintain high employee satisfaction levels, that might be a sign of positive long-term success. And then it's a question of what that really means for that shift from permanent and a temporary perspective.
Do you find that most healthcare workers are combining both full-time work with picking up contingent shifts, or do people typically pick one or the other to make up how they earn a living?
Yeah, they do, and it really depends. So if we're talking about locum tenens, you can find several reports and surveys that show you that locum tenens is actually supplemental work for them. So they have permanent roles and they're using locum tenens to supplement their income. Travel nursing has historically been full-time employment for nurses who are looking to try out different hospitals, maybe live in different locations. Per diem tends to be local nurses who are on contract who maybe have permanent residence in an area and just want to pick up shifts at different hospitals, maybe within a 50-mile radius of where they live. So it depends on which segment of the industry you're referencing, but it's a combination of both.
Speaking to some of the benefits of taking on temporary work, one of the things that we hear when we talk to staffing firms is that they're trying to speed up how quickly they pay workers. I mean, I've had leaders at staffing companies say that they're competing with Amazon. They've lost nurses who can go work at Amazon and get paid the next day. I'm curious, some of our research, 66% of healthcare workers live paycheck to paycheck. 68% said that they would pick one company over another if they got paid right after a shift. Are you seeing this trend play out more industry-wide? Are healthcare workers expecting faster pay?
Yeah, I think the short answer is yes. Who doesn't want to receive their pay quicker? And we actually have our temporary platform update report that I was referencing earlier. We found speed to be the name of the game, essentially, particularly for temporary staffing platforms. So rapid worker pay cycles or same-day pay can really vastly improve candidate satisfaction. We also have a staffing trends report that we published last year, and we identified platforms that are actually making advancements in fintech to accelerate their payroll speed and provide flexibility for platform workers. And while weekly pay does still remain the norm in traditional staffing, staffing platforms are increasingly offering daily pay, or on-demand, or earned wage access. There's all these different names, and just a number of flexible payment options. So we've observed a growing number of platforms that are already offering it or who actually have it on their product roadmap. So we anticipate further advancements in that area, but I think one of the challenges, at least presently, may be, a staffing firm's ability to ensure they have the working capital to extend payment terms, which, many health systems are requesting due to their financial situation. And we've been hearing a lot about negative operating margins, and that's causing a little bit of tension too, and makes it a little bit more challenging to implement that.
That's spot on to what we've heard as well, that cash flow to pay faster is a challenge. You mentioned the shift, there's traditional staffing firms that aren't digital yet, but there's certainly more interest from a certain generation of workers to be on platforms where they can pick up shifts on demand from their phone. do you have any advice for a traditional staffing firm that knows they need to move into this digital world? Where do they begin? How do they think about this?
That's a really good question. And I love that you brought it up because I'm actually presently working on a report to answer that very question. So I don't want to give too much away, but I will speak to some of it. I think really knowing what sets you apart from the competition. So do you focus on niche occupations, a certain segment of the healthcare sector, whether we're talking about per diem or school staffing? It's about knowing your value proposition and being able to articulate the value of your firm or your platform to a hospital. And it allows you to have a seat at the table and to negotiate. And choosing the right technology would be the next logical step, whether it be a CRM or an ATS or a platform. So we can talk about what the options are for buying that or building that, but I'll let you figure out which way you want to go.
Yeah. Do you see, is there a trend towards build versus buy? Does it kind of depend on the maturity of the organization? Can you speak to that?
Yeah, it does. And so, evaluating the right approach in terms of building it yourself or licensing technology, whether it be through a staffing platform as a service, a SaaS provider. It also doesn't have to be one or the other, which is what's interesting as well. You can take a hybrid approach, but also considering whether introducing the platform is intended to augment your traditional firm, your agency business, or, is it replacing it? So some staffing firms have actually rolled out a platform that they create as an entirely separate brand, and they run it out of an entirely different department and sometimes different location, and it just allows them to circumvent some of those cultural or internal resistance to the process change. So it's definitely something to consider and dependent upon, what your goals are and what your mission is for your company.
I guess kind of with that, I think a lot of the reasons companies are trying to digitally transform are for scale, right? They know they need to go into new markets. If they can open up their labor pool with an app, what advice do you have for healthcare staffing leaders that are maybe struggling to scale or aren't really sure how to approach scaling their business?
I think there are a number of things to consider. You can subscribe to healthcare news, such as what is offered by SIA. There's Modern Healthcare. You can join associations. So depending upon which segment you specialize in, you can think about NACO or NALTO. It's really a great way to stay up to date on market conditions and stay on top of trends and challenges that exist within the market. And that includes legal regulations, which you want to ensure that you're compliant with. Leveraging technology, which I'm probably going to say, several times because that's just where we are. That's what we have to offer. And it increases efficiency and it streamlines operations. So if we think of, technology tools, we currently have video interviewing, which we're talking about a lot, or recruiting software, and it automates, screening and interviewing, and it can increase the number of placements. You can also consider credentialing, which can take months if we're talking about, physicians, just due to the nature of their role. And it might be as simple as creating a checklist to keep your firm on track, or even considering outsourcing to a medical credentialing partner if that's a pain point for your company. So it's important to identify what you can handle in-house and what you want to outsource. I think utilizing job boards and social media and partnering with universities is another good option. It increases talent pools, and you want to be able to develop relationships with these healthcare workers who are entering the field before they even get to the floors. And then, tracking metrics and measuring your growth. So when we think about, an increase in business, you would expect that a firm would increase the size of their staff, or they would have to figure out how to improve efficiency through, technology tools that they have or artificial intelligence. And the key is really to establish a working program that allows you to collect, that allows you to view and analyze the data as you prepare to scale. And we can think of, common metrics such as redeployment rate and time to fill. But depending on a firm's data collection tools and the software that they presently have, there's already going to be a certain level of data that arises really a certain level of detail that arises in the data that you have naturally. So if we're thinking about, a recruiter logs into an applicant tracking system to manage and update their candidates, you'll be able to segment that metric by individual recruiter. It'll help you understand, origination of trends and outputs of teams as the company grows. And as the firm delegates responsibility to different managers, it just allows you to track that a lot better.
You kind of touched on briefly compliance and regulatory issues. Obviously, that's a huge topic of concern and conversation in healthcare. Anything in particular that healthcare leaders should be paying attention to right now in that space?
Yeah, I think it's important to have a legal expert to understand laws and regulations and the impact on the company, which is why I'm glad we have Fiona Coombe, who's our SIA's Director of Legal and Regulatory Research. That's definitely not my area of expertise, but it's great to have someone who is. But I think just speaking to it from, a high level, I would say it depends on which states you're providing services in, because the regulations differ by state and by employment setting. So it's going to be different if we're talking about the acute care setting or a nursing and residential care facility, which may have and does have different regulations. And it seems like many firms have a legal department that not only specializes in healthcare regulation, but they monitor legislation to stay on top of important changes to ensure that they're compliant. But there are some big ones and some recent ones. So we have states like Massachusetts and California. They have nurse to patient ratio regulations in hospitals. And then there are new registration and licensing requirements that, we're hearing are causing some issues for staffing firms. And those are implemented in states like New York and Louisiana. And then we have certain states that are actually prohibiting staffing firms from charging conversion fees. Should they convert one of their temporary employees to a permanent employee? And that exists in several states, such as Tennessee and Colorado. And that's typically something that's built into staffing firms' terms. So that's causing issues as well.
So I love to ask staffing leaders what keeps them up at night. And a lot of times it is this regulatory compliance stuff. But I'm curious from your perspective, what should healthcare staffing leaders be worrying about that they maybe aren't?
Yeah, I think I would have to go with leadership and communication. That's something that we hear from, we've heard about it over the last several years. There are numerous changes and there are challenges in healthcare. There's shifts in patient acuity levels. There's delayed discharges. There's challenges in patient acuity, compensation. There have been strikes. There's departmental restructuring. There's, technology advances. An increase in contingent worker utilization, margin pressure. So it creates tension and change in processes and procedures, and it can be overwhelming and confusing, especially for frontline workers, and especially if leadership isn't communicating timely and appropriately. So I think that starts with listening to staff and ensuring that there's an open dialogue. It includes creating a culture of transparency. Staff have to feel safe expressing concerns or talking about challenges that exist. And, we have digital tools at our fingertips. So it includes streamlining communication so that important messages are received in a timely manner by all staff, regardless of where they work, regardless of the hours that they work. And in our time interacting with and interviewing healthcare professionals, both on the permanent and the temporary side, we've heard that there's a growing disconnect between leadership and those on the floor. And we know that emotions are high for clinicians. So if we think about this when leadership participates in rounds, and that may include, CEOs and HR staff, not just physicians and nurses and case managers, which you would expect to participate in rounds. There needs to be more engagement from leaders connecting with their staff, developing that rapport, and identifying areas where, improvements need to be made. And then I think it's important that frontline workers are included in that process improvement. Feedback should not just be taken, it should be acted on. And that includes considering ideas from temporary staff, not just core employees, because they shouldn't be excluded from that process. They do have fresh eyes and they may be able to bring new information to the table.
And what are some of the things that you think separate successful healthcare staffing firms from maybe some that are struggling? Can you speak to the key differentiators there?
I think it depends on your firm's goals. So it is a big one. Are you focused on one industry? Do you serve a niche? Do you want to be a billion-dollar firm? Do you have plans on expanding internationally? Outside of that, I think there are some common themes that can be applied broadly. One is leveraging recruitment automation software. And so there's really no better time to increase efficiency by using the automation tools that we have that reduce those manual redundant tasks. We can think about, sorting through resumes and scheduling interviews. Then during a worker shortage, now is the best time. It can also result in cost savings, so it's kind of a win-win. Two would be reputation management. And, although nailing down the definitive number of healthcare staffing firms in the US is a complicated ask, a safe estimate is over 1,000, and so we're probably somewhere between 1,500 and 2,500. So from a competitive perspective, it's crucial to maintain a strong brand and a positive image through reputation management. That could mean increasing, social media followers or providing consistent communication to not only your current employees, but to prior employees, trying to bring them back, talking about open positions that you have, opportunities that they may be interested in, and then always negotiating on their behalf. And that just establishes a foundation that's necessary to attract and retain those healthcare workers. And so I think, successful healthcare staffing firms are ultimately innovative and they keep up with trends so that their offerings align with not only what workers desire presently, but what hospitals need.
And you mentioned with attracting talent previously, you mentioned job boards and partnering with universities. Are there other channels or strategies that you've seen that are really valuable for attracting that talent to a staffing firm?
Yeah, those are big ones. I think, the universities is a good one because there are rural training tracks. So then you get into access to care. So there's a number of things that you can do in partnership with universities outside of what you would normally think. Job boards, social media, and then, leveraging your network too. It's really important. We talked about associations as well. Use what you have to expand your network to ensure that you're reaching not only the broadest talent pool, but to maybe develop partnerships. Maybe you're a smaller staffing firm who's just starting out and you want to become a part of an MSP. So you're a vendor that participates in a staffing firm's MSP and you want to make those connections and kind of establish your name and your brand that way. So I think, subscriptions and associations are a good start. And then there are other things that you can do on your own, like leveraging social media and partnering with universities in your local areas or in rural areas.
I always like to end interviews on a forward-looking question. Can you talk about what trends that you expect in the healthcare staffing industry over the next year? What do you think are going to be some of the big things that everybody's talking about?
I think it's going to be a continued reliance on staffing firms. I think the ways in which hospitals partner with firms is going to change, including a more total talent model. So there may be more collaboration between firms and hospitals or, outpatient facilities. That might include, permanent staffing or recruitment process outsourcing. And that's, again, just going to increase value proposition. I expect international recruitment efforts may increase, but that really is dependent upon, immigration law at the time and any changes that we may see there. More of a longer term strategy, but it's something that you can take action on now to increase permanent staff. And I think digital transformation will continue. It's just the growth trajectory may be more of an increase to staffing platforms, which may ultimately be driven by younger workers who are entering the workforce, as they're the ones that are more comfortable with technology and they like that self-service model.
That's great. A little bit further down the line, like anything 5 years out, like you're like 5 years from now, we're going to be talking about this. I know it's hard to predict that far out, but any thoughts there?
Yeah, I think it's likely we'll see more consolidation, both from the buyer and the staffing side. There are some large successful staffing firms or even large health systems that are really in a prime position to scoop up maybe some smaller firms or some smaller health systems or smaller hospitals who have potential, but maybe they aren't faring too well. And from, a private equity perspective, we may see a decline temporarily just due to market conditions, including high interest rates. But I expect that will pick up again, even if it takes a year or two. I also think it's possible that we'll see an increase in flexible work arrangements. That includes thinking about remote work where applicable and also telehealth. And then similarly, I think that home health and retail clinics will be a larger proportion of the healthcare industry compared to their share today, just as more individuals consider their options for care outside of the traditional care setting.
This has been extremely insightful, so valuable. I know people are going to listen to this and they're going to want to learn more from you. Where can they find you online, Crystal?
I am active on LinkedIn, so you can search for me via social media. I don't think there's another Crystal Full on there, so I should be easy to find. You can also find my contact information on the SIA website, which is staffingindustry.com, and I can be found under the analyst section.
Well, wonderful. Well, thank you so much for joining me today, Crystal. I really appreciate you taking the time.
Absolutely. Thank you so much, Dana. It's my pleasure.
This podcast was brought to you by Every. We work with gig companies, marketplaces, delivery businesses, and more to pay their workers fast. You can learn more at every.com.